Wednesday, and that means it's time for us to delve into medical matters. Our resident GP is Dr. Vicky Skitter.
Hi there, it's Vicky Skitter again for the medical talk, and today I want to talk about depression. That's actually a disease and not just a mental illness. There's such a stigma attached to depression that I thought I'll talk about how it's actually not just a mental illness, but a physical disease as well. So we can destigmatize this disease. So if I go back in history, it was described as early as 1889 when the artist Vincent van Gogh, the painter, famous painter, suffered from depression and psychosis and auditory hallucinations. So he was hearing voices and things. He literally cut his ear off. There's actually a painting of him with a bandage on his ear. Cut his ear off because it made him crazy. He was in and out of asylums because that's how they treated it then. And on the 27th of July in 1890, he actually shot himself with a revolver in the chest. So they said, okay, they didn't say he committed suicide. He did die, however, 2 days later. So we assume that that was obviously a suicide. So that's interesting history for me anyway. Then when we look at statistics, depression is the largest or the leading cause of disability worldwide. So over 300 million people are affected by depression, and that's hectic. The World Bank considers it the greatest thief of productive economic life. So this is something to think about. Over 800,000 people die due to suicide every year. 800,000. That excludes the attempts, suicide attempts. It's the second leading cause of death in people from the age between 15 and 29, which is very sad. The rate of depression in South Africa seems to be like 30%. That's like 3 out of 10 people. We also, the third highest suicide numbers, we have those numbers in all African countries, and there's, as far as I remember, there's 54 African countries. So it's something to take seriously. When we look at the brain, our brain consists of 100 billion neurons, and this makes up our brain. And our brain's like the powerhouse, the mainframe of what happens in our bodies. The precise mechanisms by which depression develops is incomplete. There are a few hypotheses. So the first one that's interesting, they talk about the reduced amount of neurotransmitters, and we're talking about serotonin, noradrenaline, and dopamine. And I'm sure you've heard about the treatment with serotonin reuptake inhibitors and all of that. So those 3 neurotransmitters are linked to memory, behavior, attention, functions like your sleep cycle, appetite, libido, pain response, temperature regulation, motivation, and reward seeking. So that's that hypothesis. The other one is genetic factors. So the heritability is greater in females, that we know, and there's a whole number of genes that's been associated with depression. So that's an interesting test that we can do, genetic testing. There is something about the HPA axis that's got to do with your hypothalamus and cortisol levels. The environmental factors, that's very important. So that's when you, for example, exposed to death in the family, death of a spouse or a child, a war, people that's actually in a war. We think it's that's happening at the moment anyway. Abuse, any kind of abuse, whether it's physical or emotional. When you lose your job, for example, or you're in a major accident, or you've got a major illness. Those can all lead to depression. And then they also say inflammation plays a role in depression. So when you have inflammation in the body, you obviously get neuroinflammation as well. So your brain gets inflamed, and that's linked to major depression. For example, autoimmune diseases, stroke, traumatic brain injuries, multiple sclerosis, all associated with increased prevalence of major depression. So those are some of the interesting, hypotheses, how they, there are others, but that gets a bit boring. So there's no blood test that you can actually do to diagnose depression. Interesting, they did PET scans on patients with depression and patients that are happy. And what they found is the PET scan checks for brain activity, metabolism, and blood supply. And all of these were reduced in the depressed patients. But we can't go and do PET scans on everybody because it's very expensive. But it's interesting to see that you can actually pick it up on that test. So we say if it's a disease, it will affect your body, not just your brain or your mind, or your mental state. So some physical effects that can happen when you are depressed, for example, is insomnia, like sleeplessness, headaches, very common, fatigue, diarrhea, constipation, nausea, all of those tummy issues. There's obviously increased incidence of the irritable bowel syndrome, loss of appetite, or exactly the opposite, overeating, binging, and obviously then increased weight, losing weight, aches and pains, non-specific ones, loss of libido is common, poor memory, poor concentration, and poor decision making. So these are all sort of physical effects that you can feel or see. Other feelings you can also add to that is sadness, you feel worthless, you've got excessive guilt, anger and irritability. That's often in adolescents as well, in males, and no pleasure in activities, or, you become antisocial. So those are things that one can look out for.